Filler won't fix a wrong problem, and under the eyes, that's where people run into trouble more than anywhere else on the face. I'm Dr. Shim Ching, and after many years in practice, I've treated thousands of patients with under-eye concerns. And what I've learned is that most people don't actually understand what's causing their under-eye bags, and because of that, they end up choosing treatments that don't help or even sometimes make things look worse. So today, I want to break down exactly what causes under-eye bags, why some people look tired even when they're fully rested, and how to know whether filler or surgery is the right solution for you. So let's start with something important. Under-eye bags are not caused by one single issue. When patients come in and say, I have these bags that won't go away, we're usually dealing with a combination of aging changes that are happening at different layers of the face. First issue is volume loss. As we get older, the fat in our midface shifts and thins out. The cheeks lose some of their fullness and support, and that creates a deeper groove underneath the eyes. We often call this the tear trough. In this situation, the problem isn't that something has bulged forward, it's something has sunken in, and that creates a shadow that makes you look tired. The second issue, fat herniation. This is a true under-eye bag. The fat behind the lower eyelid starts to push forward because the structure holding it back weakens over time with age. This is genetic for many people. Some patients start seeing this early in their lives in their 30s, others not until much later. But when that fat pushes forward, no amount of sleep or hydration is going to flatten it. Third issue is skin quality. The skin under the eye is some of the thinnest skin on the entire face or body. As collagen decreases and elasticity weakens, the skin can start to look crepey, wrinkled, or loose. Even the fat underneath hasn't changed much. The skin alone can make the area look older or more shadowed. And the fourth issue is the relationship between all of these layers. Sometimes the cheek is descended a little, the eyelid fat has moved forward, and the skin is loosened, all at the same time. And when that happens, the under eye can look tired from multiple angles. Now, why does all this matter? Because the treatment you choose depends entirely on which of these things you actually have. And this is where filler gets both overused and misunderstood. Filler is a tool, not a solution for every problem. When the issue is mild hollowing and the skin is smooth, filler can work beautifully. It restores the natural contour between the lower eyelid and the cheek, softens the shadow, makes you look more refreshed without changing the shape of your face. But filler cannot fix a bulging under-eye bag, and this is a mistake I see most often. If you have fat pushing forward and somebody adds filler to hide it, what they're really doing is adding more volume to an area that's already too full. This can cause puffiness, swelling, or a heavy look underneath the eyes. It can also make the face look unnatural or distorted from certain angles. And fillers attract water. So over time, even a small amount can turn into a swollen appearance that makes the under eye look worse, not better. I've seen patients who had filler placed 2 or 3 times a year for several years underneath the eyes. They thought they were treating the problem, but the real issue was never addressed. When we dissolve the filler, the natural anatomy is usually much clearer, and they finally understand why filler was never giving them the result that they hoped for. So let's talk about surgery, specifically lower eyelid surgery or lower blepharoplasty. Surgery is not for everyone, but when it's the right solution, it gives results that filler simply cannot achieve. Surgery allows me to work directly on the structures that are creating the bag. If there's fat herniation, I can reposition or remove it to create a smooth transition. If the groove is deep, I can use your own fat to soften it. If the skin is loose, I can tighten it. And if the cheek has descended, we can address that as well. It's a structural solution instead of a masking one, and that's why the results look natural and can last for many, many years. One of the most common questions patients will ask me is, will surgery make me look different? And the answer is no. A well-done lower eyelid surgery should simply make you look rested, should make you look like yourself on your best day. People shouldn't look at you and think, what did they do? They should just look at you and think that you look well-rested, healthy, and refreshed. Another question I get is, can I try filler first and do surgery later? And sometimes the answer is yes, if the problem is mouth hollowing, but if you have true hereditary eye bags, filler won't fix it. It might camouflage it slightly, but the underlying issue will still be there. And in many cases, starting with filler just prolongs the process before eventually moving to surgery anyways. What I tell patients is this: it's better to do the right procedure at the right time than to chase the wrong solution for years. And for many people with true under eye bags, the right solution is going to be surgery. Now here's the most important part. The choice between filler and surgery is not about what's faster or cheaper or trendier. It's about choosing the right treatment that matches your anatomy. And that's something we evaluate carefully in a consultation in my office. When we look at your under eye area together, I'm looking at the fat paths, the relationship between the eyelid and the cheek, the quality of the skin, the depth of the tear trough, and how the area looks in different expressions. All of those pieces tell us whether filler will give you a natural improvement or whether surgery will give you a cleaner, longer lasting result. The goal isn't to make you look filled or overdone. The goal is to restore a smooth, refreshed under eye that blends naturally into the rest of your face. If you're unsure whether filler or surgery is right for you, that's completely normal. Most patients can't tell by looking in the mirror, and that's why an evaluation is so important. Once you understand your anatomy, the choice becomes much clearer. If you'd like to go over your under eye concerns, I'd be happy to discuss your options in a consultation. If you found this helpful, please like this video and subscribe. I talk about many different topics in facial rejuvenation so you can make informed decisions about your appearance.